You're in a quiet hospital room in Denver watching nurse Linda gently coax a resistant patient Mark into opening up. Mark's parsing his words, not trusting the system, not complying with treatment. How do you break through that wall? This isn't just about diagnostics or meds, it's about connection, patience, and the messy art behind mental health care. What tools does a nurse really need to navigate the tangled human mind? Let's dive in. Mental status exams seem straightforward checkboxes, symptom lists, quick snapshots, but they often miss the messy reality. What are the real strengths and pitfalls of these exams in practice? Mark's exam in Denver highlighted neat categories: oriented, cooperative, coherent. But under Linda's calm questions, his real story emerged: years of isolation, fear, and a mistrust of doctors. The rigid exam checklist captured his symptoms but missed his humanity. Think of mental status exams like peeking through a frosted window. You see shapes and shadows but not the full picture. You get clues, mood, memory, judgment, but the full story, that takes more than ticking boxes. It needs context, warmth, and constant reevaluation. When Linda combined the DSM-IV framework with patience and genuine curiosity, Mark's narrative started clicking. This isn't about labeling but understanding. The surprising payoff: Mark began taking small steps toward engagement, fueled by the nurse's trust, not just clinical findings. Clients like Mark often resist treatment. How do you gain trust when they push away, refuse meds, or don't show up? The book uncovers surprising behavioral science under this challenge. Mark flat-out refused the anxiety meds on day 3. Instead of insisting, Linda shifted gears. She focused on small goals, like daily walks and simple breathing exercises, ignoring the medication battle for the moment. This tactical retreat felt counterintuitive but cracked open his willingness. Trust isn't a switch you flip. Picture it like building a Gothic cathedral stone by stone, arch by arch. Linda knew each interaction laid bricks of respect and safety. Noncompliance wasn't rebellion but a plea for control. Through small, consistent acts, trust accumulated. Weeks later, the once rebellious Mark asked about meds himself. Patience wasn't weakness, it rewired his resistance into a meaningful alliance. The big insight: mental health trust is earned in inches, not leaps, reshaping how you see not complying. Treating anxiety disorders isn't about wiping symptoms overnight. What behavioral objectives are actually achievable? Bari's text uses DSM-IV to ground this in reality. Instead of aiming to eliminate Mark's panic attacks immediately, Linda set small wins: mastering one anxiety trigger, learning 3 coping strategies, and improving daily functioning. These clear, bite-sized goals kept Mark motivated without overwhelming him. Bari compares treatment goals to climbing a ladder, each rung a manageable step, not a giant leap. Anxiety isn't cured by jumping to the top, it's negotiated one measured step at a time. This prevents burnout and builds confidence. By redefining success as gradual improvement rather than perfection, Mark's treatment journey changed. Embracing setbacks as part of growth created a richer therapeutic bond and a surprising sense of achievement that no checklist alone could provide. Back in that Denver hospital room, Mark isn't just a patient on a checklist. He's a person shaped by trust, patience, and realistic steps. Mental health care thrives where data meets empathy, where your curiosity breaks barriers far beyond the DSM-IV codes. Next time you face resistance or anxiety, try setting one small, clear goal and watch trust and progress start to build. Subscribe for more book summaries like this one.